Hello everyone, it is Rachel here for Revive and Thrive. We have a very special episode for you today. Here is Rebekah.
Hello, 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 Hope Inspired Fitness ladies. I am so excited. I've been waiting for this episode forever. Okay, now you do not see her, but behind the camera is my favorite physical therapist, Hope. You cannot see her, but I love her, and she's one of the reasons why I wanted to do this, because I want more women to know and spread the word. Dr. Hayley here is going to be our special guest of honor, and she's going to answer a few of the questions I got. I had to kind of narrow it down because we can't be here all day with Dr. Hayley. We can't take up all of her time, but she is gracious enough to bless us with her presence and her expertise on pelvic floor health. So Dr. Hayley, would you like to go ahead and tell us a little bit more about yourself?
Yeah, first of all, thank you so much for inviting me.
Yes.
Anytime I have the opportunity to talk about pelvic floor, I think is a good one.
Mm-hmm.
But yeah, I have been practicing for 4 years now. So I graduated in 2020. I pretty much right away, I knew that I was interested in pelvic floor therapy. My final clinical was with a pelvic floor therapist in school. So yeah, I already knew I was very passionate about that. And so yeah, I started on that journey. And then about 2 years ago, because my daughter will be 2 in September, so I had my own baby. And through that experience, as a lot of us know, can be very eye-opening. And I have a whole newfound appreciation and just ability, I think, to sympathize with women, especially who have gone through that process. So
Yeah, it's true. Once you've gone through it, definitely it's different. I feel like there's so many women who are like, why did no one never tell me this, you know? So it's like, we're going to be telling you this. So,
All of it.
No, yeah, and I guess besides pelvic floor, I do treat pretty much anything else. I work downtown Grand Rapids, so I know we're at our Granville location right now for Fuel Health and Wellness, but I usually practice downtown, and I see anything low back pain, hip pain, shoulder pain, but my love is pelvic floor. Especially, I have a special love for pregnancy and postpartum. So
Awesome.
I'm happy to be here.
That's my thing.
Yeah.
I understand the passion.
Yeah.
When you see moms with babies, do they get highlighted to you? You know what I mean? Like they're like, it's like, I don't know, I always explain to my husband, it's like they're in different colors. I'm like,
Yes.
it's a mom and a baby.
Yes.
I don't
yes.
know, like
It's
it's just,
There's something special.
there's just
about
something special, but yeah.
Well, you have a
Gravitate.
passion for anything. I mean, I have that in a different aspect, but yeah,
Yes.
when you have a passion for anything, you're like, ooh.
Yes, that is very true. All right, Rachel, I'm going to go ahead and get us started.
Yes,
You
let's
ready?
get started.
I'm ready.
Okay, so here we go. Question number 1. Dun, dun, dun. No, I feel like we need some like, you and
add some.
Who Wants to Be a Millionaire? Does anybody remember that show? Anyways, I know this probably needs to be okay. Question 1. How do I know if I should see a pelvic floor therapist? And is there a way to know if my pelvic floor is too tight or too weak? Good question.
Yes. So, kind of a long-winded answer, but
Yes.
pretty much, if you feel like if you've been having pain, or let me back up. If you had a baby, that's a big one, right?
Yes.
So, and your doctor may or may not recommend that, but I highly suggest that you seek out a pelvic floor specialist or somebody like yourself, right, who can determine whether or not maybe you need to go see a pelvic floor therapist. But that's a really big reason if you're postpartum or if you're pregnant and having some issues, some pain, concerns, whatever it may be. If you have any low back pain, any hip pain, any abdominal pain, any of those things. Also, if you've been experiencing pain with sex, whether
Yes.
you have or you haven't had a baby, you can still experience this. You don't necessarily have to have a baby to experience that. Other things would be if you're leaking, maybe with coughing, sneezing, laughing, whether it's just a little bit or it's a lot, or if you're leaking with exercise,
Yep.
that can be another reason. Or if it's not just urinary leakage, but fecal can also be a part of that, or gas that actually falls under that as well. So unwanted gas that shouldn't be coming out and can be embarrassing. So yeah, you can see a pelvic floor therapist for that, or you should. And then I'm trying to think of anything that I haven't thought of. I should have my own list here of things to think of, or Hope can shout some out. But going maybe to weak or tight, you asked me that too, or how do we know if things are weak or tight? So these kind of go together. So symptoms of a tighter pelvic floor would be pain with sex specifically, or just pain in general. Whether that's low back pain, like I said, hip pain, pelvic pain, doesn't have to just be like pelvic floor pain. If you have a high stress life, actually, so anytime you're just very stressed, that can add to more tension holding. Or like you were expressing to me about neck pain. Sometimes neck pain correlates with
That's what I learned
floor
from this one over here. You
tension.
can't see her, but that's what she taught me.
Yes, it's very common. They go together.
Yeah, they do.
Clenching your jaw, stuff like that. That's also on the tightness side. Recurrent like yeast infections, or what's the thing I'm blanking on? Not a yeast infection,
Like a bladder infection?
bladder infection. Kind of same. So
urinary tract.
UTIs. Thank you. That's the word I'm looking for. It wasn't coming to my brain, but if you have recurrent ones and they test you but they are negative, that can actually be a potential sign that you have pelvic floor tension. And then also constipation would be a sign of tightness.
Okay.
So constipation more than the opposite. And then really any autoimmune, potentially like IBS, or we have like PCOS, so polycystic ovarian syndrome, or endometriosis. A lot of those diseases, I would say, or those autoimmune diseases, will correlate with having tighter muscles because they're associated with pain and your body guards.
I have a question that's not on the thing. Okay, this is a bonus round. Sorry, Rachel, I'm putting you on the spot. Okay, this is my question to you. With a tight pelvic floor, Rachel knows this. Every single labor I had was 2 to 3 hours of pushing because I was so tight. Was that because of my autoimmune or whatever? That's just naturally like tight, or was I doing too many exercises? I was very anal about that because I didn't want to be.
It could.
I didn't want to do extra work at the end of it, but every single delivery was 2 to 3 hours, and they would end up having just to do super deep cuts in me just to so the baby. And I mean, I had 5-pound babies. It's not like they were big. So was that maybe part of it? Because my doctors would be like, "Oh my gosh,
so they
you're so tense, you're so tight."
They do an episiotomy where they cut through. Which is, they're trying to make that become less common. I know they're doing less of them, but at the same time, it does become like life or death, right, of baby. So they do want to make sure if there's an issue there that they want to get out quickly. But could that be related to autoimmune, is what you were kind of asking? It could be. I think too, before birth, so prepping for birth, yes, we should think about strengthening, but also continue to stretch at the same time. And so I
stretching it out with that. What was that oil that you made me use? I don't remember.
Like doing like your
Well, that's where her and I had differences. So I remember after her first, her doctor was like, "You need to stop doing up too many Kegels," like, because I remember, and it was great for me because I'm an esthetician, so to see all these different layers, I was like, "Oh, this is really fascinating," and I love that anatomy kind of stuff. But for me, it was the opposite. My doctor, he was very emo oil, like massaging, like, I mean, even, I don't know if you remember with my first, my nurses would come in on the regular and just
her nurses would come in and massage her.
And I never once was cut.
I never
tore. And I'm just like, geez, Rebekah, you really do need to start doing Kegels or something. Why
it's like 20 minutes of pushing.
I'm like, but that was my routine. Like, when I would get closer to labor, then, I would start massaging.
Which is awesome. Yes. So your doctor told you to do that? Did your doctor tell you to do that?
No, but she had her babies, all of her babies in Lansing, and then I'm mostly West Side, so I'm Kalamazoo, so everyone was like Bronson, right? So I'm like, what? None of my nurses were coming and massaging me and like trying to make sure everything was.
Did you both have OBs or did you have
Yes.
midwives? Or
Yes.
did
She had
you...
OBs. I had like just a family practice.
Okay.
Just a general.
Yeah,
But I had great nurses. I will have to say, especially I think you learn a lot with your first. My first, those nurses were all, gosh, I don't think any of them were a nurse less than 25 years. And then my doctor, he was just amazing. It was actually, my first daughter was born from a different doctor than my last three. But it was a husband and wife combo. And they must have really learned that because they were very much onto that, and the nurses stuck with that, and it was and they were young. They were young. They were a young couple.
Sometimes that having a young doctor that is more immersed in like
Yes.
newer research and newer things is a good thing and helpful.
Yeah.
I too actually did have. I actually had a group of midwives, and they used oil, and like I remember them like when I was in like middle of crowning and stuff like putting like warm compresses on like
awesome.
the area. Yeah. So I do think sometimes their education is a little bit different, and then some just they spend a little bit.
All right,
more
so then I
time,
should keep recommending that to my pregnant mamas because I'm like, listen, don't be like me.
Well,
Massage, oil. Talk to your doctor.
Yes.
Make sure your doctor is like
you want
teaching
a good
you the things.
You want a good combo
Yes.
of both is what I would say,
Yeah.
especially around like a month before you should be giving birth is when you
Yes.
should really start doing like perineal
Yeah,
massage.
that was about a month is what they when they would say
Yep.
start massaging.
Yep. But pushing, I want to come back to that because pushing is a different thing entirely. And sometimes, so this is more coordination, if anything, and you want to make sure, because our pelvic floor, Kegels are very isolated,
Yes, yeah,
right?
yeah.
But our pelvic floor, and when we give birth, needs to work multi-segment,
yes.
with everything.
Yeah, yeah.
So your core has to work primarily, your diaphragm and the pelvic floor all need to work really well together. Sometimes, especially when you're fatigued, you've been pushing for so long.
21 hours.
Yeah,
Bella.
yeah. That sometimes flies out the window. Also, positioning of how you're giving birth. So, if you're on your back, which is the traditional, right? You don't always have as great of movement because your tailbone and your sacrum are stuck on the table. So sometimes shifting to sideline or a different position allows you to move a little bit better. In between the position and then making sure that you're getting more of a bearing down and the pelvic floor isn't contracting during birth, those can reduce risks of tearing along with pushing. So what I'll see is, and what research shows is that if you push actually less than 30 minutes or greater than 2 hours, then you have a higher risk of muscle tearing.
Oh,
the
yeah,
pelvic floor.
I
So
believe it.
too fast or too slow, both have their risks.
I will have to say, I do feel like with your verse, you were more flat. For me, I was really like, I need to be up. Like, I kind of was like, I don't care if you put me in the toilet. Like, I just want to at least kind of sit up as much as I can. So whenever I don't know if you remember, when I really was like trying to hunch and like sit myself up, almost like a big crunch, because I'm like, I don't want to be just laying here going like this. Like, you know what I mean? But for Rebekah, unfortunately, I remember especially with your first, she was in the middle of a hemiplegic migraine. And so they actually had to have covers over her eyes. My dad was doing pressure points on her neck.
They probably had to have her
And
lay
so
down.
they had to have her lay down. So it was just kind of like this anti-gravity. Like it was an interesting situation.
So things that are out of your control.
Correct.
That you can't.
Correct. So sometimes
I had to
it's
be on
just
my
those
back.
things, that labor is labor, and we don't. You may plan a book, but I tell you what, the book may not be fulfilled 100%.
Yeah, you can always plan, but
Plan, but
How it is how it is.
Ray, you want to go with number 2? Wait,
Yes.
we kind of answered some of this, but we'll ask anyways, and then she can.
we'll probably come back to more.
Yeah.
I think weakness is what we didn't cover,
Yeah.
but we can come back to that.
Yeah.
Can pelvic floor PT help with the vaginal dryness?
Yes, so I think really where it comes to that is a little bit of education, I would say, especially depending on when someone is experiencing dryness. So It's really common after you have a baby, especially if you're breastfeeding, because all your hormones are going up here and focused on baby, so down here doesn't get as much attention. So that's a really common time for women to experience a lot of dryness. So using a lubricant, I would highly suggest that everybody uses one, but one that might be more water-based, or depending on if pH is an issue, which we were kind of talking about a little bit, maybe an aloe-based. But another time where dryness kind of comes back is also menopause. So the good old change of the woman's body. So there's lots of changes that occur around this, but dryness being one of them, muscle tone being one of them. So I would still come back to lubrication being the main thing with that, and really around menopause, talking to your doctor to make sure that hormones are in check, and that's more of a doctor conversation. Also, I would say, because I know you had a couple questions too about like hysterectomies. So when you have a hysterectomy, that's going to change your hormone balance in the body too. So that's probably a great time to also talk to your doctor about maybe vaginal dryness. There may be something other than pelvic floor PT that can help with that.
The educator in me, apologize.
Yes.
I want to circle back to that first question because we didn't really finish with the weakness. We talked about if it's too tight. What about the weakness? Like if someone have a weak, what is that sign?
So, good question. If somebody has more weakness, they probably, they may have some heaviness feeling. You may also have pain, but heaviness, kind of like that falling out feeling. So I'm kind of, I'm talking a little bit about prolapse, which we may talk more of, but that would be a sign. Another one would be probably leaking gas or incontinence, whether it's urinary or fecal, but it's more so going to be more than just a little bit. It's probably going to be accompanied with like urgency and then not really able to control that, and you need to either change your pants or pad or whatever it may be. I was going to say you're probably more likely having to wear a pad just in case, or and it's probably happening more often than just like every now and then. Like sometimes I feel like with stress incontinence, with like cough, sneeze, laugh, if it's more of a tightness issue, it might just be a little bit that happens every now and then, but not every time. But if it's more of a weakness issue, it's probably going to be more, and it's going to be all the time.
Which we see a lot in our office where I work. We have a lot of women who are older than usually 60 who, you know, and our Dr. Ron says it all the time. He's like, you want to know why little old ladies have a lot of perfume on? It's because a lot of times they will have that weak pelvic floor and they have so much that urination. And so that's why in our office we do, you know, something to help with that. But it is one of those things that definitely weakness can just kind of make you keep trickling.
It's a good faucet. Age is a good indicator too, I would say. Like really, the older you are, you're probably, like you were just alluded to, it's probably going to be more of a weakness issue. The younger you are, it's probably going to be more of a tightness issue more commonly.
Perfect.
All right. What ways, this is one of my favorite questions I get. This is from one of my mamas, and I already answered this question, but now you get to hear professionals say it. It won't just be me. Okay. What are ways we can help our pelvic floor stay strong during pregnancy?
So, actually, one way would be to work with somebody like Rebekah, actually. Yes. Get to take a couple bows. Seriously, because not only will that help you stay strong, but it will help you just be more confident, I would say. I think a really big thing with pregnancy is women, if they were working out or if they weren't, they just won't do anything because they're afraid of it maybe harming their baby, or they've been told by their doctor. I can be someone, or I can admit that my own nurse told me right around, I had like a call before I even came in the office. I think I was like 10 weeks or something like that. And she told me, don't lift any more than 10 pounds. Yes, and that's very outdated information.
Annie was doing CrossFit like the whole time she was pregnant, so
Right, no, I literally that morning I had gone to a CrossFit workout and I was like doing squats and all that heavy over 100 pounds. So yeah, that's a very outdated, but if I have that knowledge, but
Yes.
if they were to tell someone else who
Yes.
didn't, right, you're going to listen to your doctor. So that I feel like, now I went on a tangent, I don't even know where I was going, but what the question was, things that you can do to stay strong.
Because pregnancy is like preparing
Yes,
for a marathon.
Our father would say that all the
Yes,
time.
my father would say that when we got pregnant, he's like, you better start working out more because you're preparing for a marathon.
Yes.
He would just-
This is true. And yes, I really think working with a professional is really the best way to go. And I would say working with somebody like me, if you start to have pain,
Yes.
especially,
Yes.
or maybe, pain would be the main thing, or really just a concern. You could kind of work with either of us. But I think ultimately don't stop exercising. If anything, continue
If you were
to
already
move.
exercising, just keep.
Yeah, and if you
Well,
weren't, it's not the best time to just jump into something super hardcore.
Oh, I like her.
But-
she's preaching what I preach to all my. You see, I'm not the only one.
Yes, I love this. Yes. We've got the same brainwaves here.
Yes.
I would say, but it is
But-
still good to exercise. It's just not the best time to,
Start a new program.
something
Try
brand
not to
new.
get your PR in.
Exactly. Yeah. Yep.
Not
Just
trying
move.
to. Yeah, until you just want to move. Yes.
Yep.
And I
exactly.
remember, I mean, this is something that, Rebekah and I both, whenever we got pregnant, like we said, my dad would say, you're training for a marathon, but I would always say to any new mama out there, and still do, it can be a marathon. You don't know what your labor is going to look like. You don't know what your recovery is going to look like. So if you are already in a fit and healthy place, your recovery should be much less.
Much better. Yeah.
And really just you're really preparing yourself, I think, mentally too. Yes, a physical change, but a lot of mental and emotional. And I think working out really does. It helps me mentally. It helps me emotionally. So just getting in a good habit and keeping to that good habit, and hopefully will also encourage you to just make healthier choices during your pregnancy, because a lot of times I feel a lot of women use pregnancy as an excuse to just kind of let the winds go, and it's harder to lose the weight when you have a newborn. Just to speaking of for children,
Say that again.
but so to get in those healthy habits are a great thing.
Yes. Yes. How do I stop peeing when I sneeze?
Good question.
Brace.
Yes, I'd say maybe you know the answer to this. I don't know if that was something
Yes,
I heard with her,
yes.
but yeah. So we already talked about a little bit why that might be happening.
Yep.
On either side, it could be weak pelvic floor, too tight pelvic floor. Often stress incontinence is a combo of one of those and then coordination.
Yes.
And that's usually the biggest thing. And once you get the coordination and how you need to do timing correctly, it does.
It becomes habit.
Yeah.
So if you see a pelvic floor therapist, which I highly recommend after baby, she will teach you, and then it's so innate in me. I just know it. If I'm getting ready to sneeze, I do a deep diaphragmatic breath, and it's so ingrained in me. It becomes a habit.
Mm-hmm.
When you pick something up heavy, when you sneeze, when you cough, when you lie, when you're running, it just becomes so.
Yep.
It's just a part of you. I don't even know how to describe it to people anymore because it's just so.
Yeah.
It's in me.
Yes.
I don't know.
It's great. Yeah, that's what you want. That's like the therapist's dream. That's what the patient is.
It's done.
Yeah.
It's done. But
Yes.
so yeah.
So really, I think if you are struggling with that,
Yeah.
I think it can be helpful to work with a therapist, because I really think the PT can help you feel what you need to be feeling. Because
so
I think
it's not. A lot of times when I don't know about for you, but when I'm having a mama learn about how to engage her TA again, she sucks in.
Yeah.
And it's not. You have to explain to people you're not sucking in. And so to be able to have a professional that will be able to explain to you what you should feel, how it should feel, and they can actually look at your body and see if you're doing too much chest, if maybe your ribs are flaring, like things need to get more aligned. It's so helpful. Even if I just say, I don't know, I could be wrong. You're the professional.
You're doing great.
if a mama has a baby, I really believe even if she can just go twice, would be helpful.
Yeah.
2-3 times
Yeah.
would be huge.
Yup.
Yeah,
Huge.
I would agree with that. I think
Like it's not. I'm not saying you need to go for 8 weeks.
yeah.
If every mama can go at least 2-3 times, I think it would be so helpful.
What's even better, I think, is going at least once or maybe 2 times before when you are pregnant. Just so you have an idea. You have a lot of it's education. Just what should you expect on the side of, well, when you go to the doctor, you're being told what to expect really on the side of the baby and really more just the procedure of all that, but not necessarily what to expect symptom-wise after you have the baby, or if there's just not as much of that education, I feel like that happens at the doctor's office. So going to see a pelvic floor PT, or honestly somebody like you that has been through that, they can get you to breathe deeply, help you to learn how to push.
Yeah.
We were talking a little bit about that earlier, but sometimes pushing is a learned skill, and it can really help your birth process if you learn that and then know what to expect for after. There is research that does show that having pelvic floor PT before, or when you're pregnant, so before you have the baby, helps reduce pelvic floor dysfunction afterwards.
Yes. So I wish I would have had that
too.
before.
I mean, it probably. Would you say that would then maybe possibly then cut down the time for pushing if they learn? To me, that's how my mind is seeing it, but I don't know.
Yeah.
Honestly, I would think that the answer would be yes, right?
I would say so, yes. I don't know if there's been a specific research, that's done that, but my mind would tell me yes, that would be the case. Obviously, things happen in birth, like we talked about earlier, that you can't change, but
sometimes if your body's tired and because your kids want to take forever in labor, your body gets a little worn out.
Well, if you had hemorrhaging or like they get laid down because like all of those.
There's a lot of things that can happen, but if we can do our best to do what we can to prepare ourselves, I think knowledge is very, very powerful. If you have an idea of especially for new moms, of what is considered normal after baby.
Agreed. And preparation for what doesn't happen.
Yes.
I like to talk about that too. Like you can have a plan, but you need to be prepared for what you're not planning and hoping for.
Yes.
Like we're talking about. So,
yes.
Yeah.
Yes.
Yeah.
So this is the next one that was asked from
I think these two go together.
our wonderful, beautiful mothers out there. Do genetic family history of weak pelvic floor affect our pelvic floor, or is it more? So knowledge is power. And then it also says, does weak pelvic floor affect posture or cause back pain, which we did kind of address right through there. Our pelvic floor muscles are connected to either part of our body. If our pelvic floor muscles are weak, then another part of our body could be hurting or weak.
Yes.
So I guess, we kind of already
answered a lot
of that. So yes, it causes back pain. if I
Mrs. B is the one that answered that question. I'll see you tomorrow. Okay. I think we kind of did already answer a lot of that, but
like this.
want to go kind of more into that, like genetics, because that's what she was asking me, and I'm not sure about the genetics part, but
I think genetics can be kind of more a zoom out on really anything in the body. So like even some of my clients who aren't actually coming to me for pelvic floor, but they do have back pain, and they have had parents that have had surgeries or back pain in the past. So it's structurally how you are made, how you're built.
Oh, that makes
can
sense. Okay.
put you at maybe more of a risk or not. And if you're, you come from your parents, so they give you that genetic structure. But I do think it's not just structure, but then also what you do outside of that. So kind of like that nature versus nurture a little bit. And then, what was the other part of that? Oh, low back pain, just how everything's connected. So, really the pelvic floor doesn't work in isolation. Part of the pelvic floor muscles work on hip rotation. You're saying, all those things. Your core is just as important as your pelvic floor, as your hips are, and your back. when it comes to the whole system. So I know we're calling it pelvic floor, but when I treat somebody for a pelvic floor issue, we are looking at their upper chest, their abdomen, their hips, looking at everything, even sometimes up to the neck, right? Because how people hold tension here can impact it's all.
Something with my hips, because we were working on my psoas that time, but she like was moving my hips and just her watching my neck. And she was like, I think your neck pain is related to it was crazy. And so when she started working more on that got better. When this was getting better, it's like how it's all
Can I just say, physical therapists are the most amazing people.
Yes, they are.
My personal opinion. So
I
yes, I love them too.
Yes, I agree.
Yes, I had a great PT when I had to do through my PT for my neck, and I learned so much stuff. So
They're pretty amazing people. Okay, the next question said, I had a traumatic birth, and it has affected my ability to poop. I must use a stool softener now. Is there a link to this in my pelvic floor?
Yes, a big link. So as the pelvic floor as a group, responsible for peeing, pooping, sex, 3 main things. So having a traumatic birth, I'm only assuming that there was likely tearing with that, which not to go into too much detail, but there can be different grades of tearing, which the more that it is can actually tear into like your anal sphincter.
Yeah, that happened. I had a student that happened to her. Yeah, they had a.
Yes.
All the way through. She said yes.
Yes.
I was like, I'm so sorry.
Very traumatic.
That is very traumatic.
So, yes, actually, that will then definitely have an impact on going to the bathroom, pooping specifically. So, my suggestion would be see a pelvic floor therapist.
Yes.
Like,
I know who
sure.
asked this question, and I know you live by U of M. There's a lot of good doctors over there, so go find a doctor in Ann Arbor.
And sometimes, I will say sometimes you don't always have to see somebody in person.
Yeah.
I do some virtual stuff. I've worked with people all over the country, and sometimes you need more than virtual, but sometimes it is heavily education, and I can still see how people move and stuff online, but sometimes that's a good starting point. And then if maybe we think you need to actually see someone in person, I'll say this person's in your area, go check. But that's definitely I would say go see a pelvic floor.
Because something is not something needs to be
Thank you for
connected
saying
to
that. That's good to know for our viewers out there that you do virtual.
Yes.
That's awesome.
Yeah.
Very cool.
Yep.
That's cool.
You ready for the next one?
Oh.
Refill?
Yes.
So, do you know who asked this question, Rebekah? It seems like you know.
Yes, I do.
Okay. So this person states that they never thought they had a weak pelvic floor until after they had a very large incisional hernia repair surgery. Since then, I feel weaker in my core and pelvic floor. What should I do to get back to normal?
Good question. So, and this I feel like this one kind of goes into a little bit of how everything is connected. Because, and specifically with a hernia, which is kind of right in that groin.
Yes.
You're going through multiple layers of the core right there, even if it is just a really tiny incision. If you imagine the pelvic floor and just this whole system has been compared to like a can or a canister of stability. So if you've got like literally a pop can and your pelvic floor is at the bottom, the whole outside is your core and like your back. Top is your diaphragm, which is our big breathing muscle. The minute a hole is poked in that can, it's going to change the shape of it. It's not going to be as stable, right? So it's not going to be as strong. So anytime you have any kind of surgery, whether it's hernia, hysterectomy, if it's an abdominal incision, C-section would be another one, or literally any abdominal surgery, it's going to change how those muscles work together. So not that they can't.
I love that. I feel like I just that little bit of that can. I like to imagine things. So that's really cool because actually I see a lot of gentlemen who have had hernia surgeries. My husband's one of them, but I have a lot of clients who are like, right, whatever, and I like have to, I treat them for other things with the tools that I have, but you could see a pelvic floor specialist too, gentlemen. Anyway.
Yeah.
Yes.
All right.
You also have a pelvic floor.
Very cool. I don't know. That just is like, oh, that makes
Actually,
sense if they feel this way.
What's really, I know this is not men listening, but what's really interesting about men is that through that inguinal canal, so in utero, basically the testicle, the scrotum is actually pulled through there, and so literally the scrotum is all the layers of your core. So that's why when men are more susceptible to hernias, and they, that's the connection there.
I learned something new today.
Yeah,
I learned good. All right, that's awesome. That's very cool. All right, Rebekah.
I just had a total hysterectomy. This is the one I got like at midnight. And I was like, oh boy, I can't answer this question right now, but I know someone that can answer it tomorrow. I just had a total hysterectomy and I'm excited about strengthening my pelvic floor. What are some good recommendations for someone who's supposed to lift no more than 10 pounds and wants to get back on her bike sooner rather than later?
I feel like you could
We
also
just
answer
answered
that
a lot
really
of
well, just as much as I probably could. But yeah, I think step one would be to start with like some diaphragm breathing, honestly.
Yes.
Can that person, get that canister moving appropriately. And then from there, there's a number of different ways we could go, but you'd probably want to target like glutes as well. And anytime we can target like adductors, so inner thighs with our core, we get more bang for our buck is what I like to say, because they all share very similar connections and nerves too. So I don't know if I have a specific exercise. I think it's dependent on the person.
One of the ones I like to do, one of my favorites, I love my small yoga ball for all my moms. I love that thing. So when I'm
just like
I was gonna say when someone's like in a supinated position, but I'll say on your back. So when you're on your back, I like to put a yoga ball in between your legs, and then you're gonna do some adductor work, and you're just gonna push it. But first things first, you're gonna be laying on your back, and you're gonna do a deep diaphragmatic breathing 3 times, just because I want to know that when you're filling up, I say flower or balloon, that's what I think of. I think of a flower opening up and then closing, or a balloon opening up, or an umbrella, whatever you can think of, right? And then you're going to engage your TA, and then I always say, like you're holding the floor of a urine or a fart, or picking up money with your crack, whatever. You're gonna slowly pick up. I wish I could do this, show you.
You probably could.
Live. I'll be on here live on Monday and I'll show you. Anyways, and you're gonna squeeze that ball in, while you're exhaling, you're gonna hold it for a few seconds, and then you're gonna release. And then I want you to release everything, your pelvic floor, everything. Release, and then re-engage. Okay. Does that kind of sound like, I wish I could show you.
No, I love that
because it's one of my favorite moves that I like to do.
It encompasses everything that I was just saying.
And then you're inhaling, and then that way you're working. You're doing your core. You're getting your deep breath. You're doing your TA, and then you're doing your adductor. Anyways, it's like a one-stop shop, and it's really good for. Especially, I like to do it for my mamas who are 6 weeks out and postpartum, and it's like, let's start, right? Especially if they have diastasis recti, because we don't want to do a lot of twisting. Like, you want to just get the core back into bracing. And anyways, that's one of my favorite ones. I wish I could show.
No, really, to start, I think
Does
that's
that sound
great.
good?
Does
that sound good? That sounds good. I don't know if I
There's
explained
a lot
it,
more,
but I'll be on here later to show you.
Go into.
I know there's like so many,
there's
but
some
that's
time.
like one of my favorite ones, because it does like, it's like the one-stop shop. You get all the things done. Boom, boom, boom.
The only what you could add to that, if you felt like that was easy, is add a bridge into it.
Yeah, exactly. And that's the next. That's stage 2. So my stage 1 mamas, because they're usually your abs are like feel a little wonky. I don't know how to you just no, whatever. But yes, my stage 2 mamas, that's like their favorite one. I add the glute the glute. Anyways, okay. Sorry. Okay. Where are we at? Oh, wait. 8. Okay. Do you want to go?
Intercourse is painful. Why? And what can I do to help with that?
CPT.
A lot of these blend.
I know they blend.
Yes.
They blend.
Do you see what's happening here? See the trend?
Yeah. It's a very good question. It's something I feel like a lot of people deal with, even if maybe they don't tell their doctor. They kind of just deal with it. But it could be a couple different things. So it could be maybe just overall tightness. That's probably the most common thing, is that those muscles are tight, whether it's there's multiple layers of the pelvic floor, and whether it's the first layer where it's just upon insertion, or if it's the deeper layer, which is more of a deeper pain, it's probably tightness most likely there. Another reason could be something called vulvodynia, which is kind of like this burning sensation, which is more of a nerve issue that's going on, and you can have these go together as well. That's really common after having babies, especially if you had stitches and you had tearing, to have the muscles that were maybe cut through, and then also have some nerves that are just a little hypersensitive. But also, you don't have to just have a baby to have had or to have painful sex. You could be someone who doesn't have any babies either. And it most likely is a tightness thing there as well. So coming to PT and working on how to relax those muscles, try to lengthen them, how to deep breathe, de-stress, all of those things.
I have a personal question. This is a side note to everyone. So even before I had my babies, I would have, and it wasn't always a constant thing, but I was told from when I was diagnosed with PCOS that these are things to look out for that may happen. And then when I started seeing the doctor I have now, he said, well, that actually kind of makes sense. It all correlates. For me, my painful sex is usually very, very deep. But I always notice it's around a certain time, and I usually will have cyst. So usually for me, if I hold around right here, then it stops hurting. So is that more like an inflammation from my cyst? Because it's not a constant thing.
It's like pulling. It sounds like it.
Yes. This is another, that's a technique even I'll use sometimes when I'm working with somebody. But fascia, fascia is like the connective tissue that basically holds everything together. There's a lot of fascia in this area around our organs. You've got ligaments too that are holding your pelvic organs kind of up against your back, which is why sometimes you can get low back pain.
Oh man, my back pain is horrible.
Yeah, and you have.
I'm dying. Oh, I know. It's just my period's gonna start.
You have ligaments too that are connecting like your organs. Up. So right when you've got cysts going on, you're literally just slacking the tissue. So when you have pain, you guard, everything gets tight. You're not stretching, you're slacking and giving some space and some room, and that usually feels better. So that's
I feel so bad for my husband, because he's always like, I'm always like, hold on. I gotta do this for a second. Okay, and he's like, what? He's like, Rachel, come on, if you're in pain, come on, we can stop. I'm like, no, I just have to position myself. But it's always worked for me, because I know that pain is never a constant thing. I always know it at a certain time. I know I probably have cysts. I hold them down, and then I'm fine, and then it goes away. So, but even asking my OBGYN, they're like, well, it could be, and I'm like, no.
Yes.
And sometimes, and doctors are amazing. Your primary doctors are amazing. OBGYNs are amazing, but sometimes I feel like, at least in my experience, even when I worked with my neurologist to then working with my physical therapist, I feel like I learned more from my physical therapist than I did my neurologist, and he's an amazing guy. But I think there's just something that you guys just have a little bit, a little bit more extra, because your goal is to really heal, not just here's a medication, but you know what I mean? It's a little bit different. Like, you really want to treat and take care of that symptom versus just kind of here's the
I
or cut
appreciate
it out
that.
But no, I was like, I'm gonna ask her, because I've asked my other doctors, and they're like, well, you have PCOS and and if it's only every once in a while, so I'm like, I'm gonna just see what Hayley thinks.
That was a really
Yeah.
good question.
Those are good. When I went to Hope for because mine happened, I never had any issue with my pelvic. I mean, my TA, I always felt fine.
Mhm.
But after I had abdominal surgery a couple years ago, when I put on 40 pounds, I will lose it. Anyways, the other thing that bothered me the most was all of a sudden it was painful. And I was like, but thankfully, since I've been in somewhat of the whatever I know it's normal for me, I knew I need to see OB/GYN because this is not normal. I cannot engage my TA. Sex is now painful. Sometimes something's not right.
Yeah.
And so don't wait, ladies, because the waiting list is forever usually to even get into your OB/GYN, to even get a prescription, to go see a PT. And it was helpful to me because I learned about deep breathing and relaxing and all these other techniques that her and I would work on during our hour session. So it was super helpful to me. So do not suffer alone. Don't suffer in silence. Sex is not supposed to be painful. And so you just go seek some help. Take care of you. Okay.
Hold on, I want to spin off.
Yeah.
Okay. Is that okay?
Yes.
Sorry. Yeah, because I agree. I love that you were talking about doctors, and
Yes.
I agree that they do great work, and
Yes.
I don't want to be dissing
Yeah.
them or anything.
Yeah.
I love having doctors on board.
Yes.
And I love when doctors refer their patients to me
Yes.
too. But I do think the nature of coming to see a pelvic floor therapist is their job is to spend more time with you. And what I don't want my evaluation or my examination to be painful. Yes, we were trying to figure out what's going on,
Yeah.
but my goal is that it's a very safe space, and obviously this is all with consent. Like, I'm not going to do anything that isn't okay with the patient. I do vaginal exams. That's a part of what I do as a pelvic floor therapist, but I don't always have to do that. So I've treated people without doing that as well.
Yeah.
Yeah.
And I had to just explain this to one of my clients because she advised her to go to see a PT, and so she was going, and the lady at the reception, she hasn't seen him yet, she goes in a couple weeks. The lady at the reception actually told her, prepare to be in a lot of pain. Because pelvic floor therapy is, if you're having painful sex, you're going to be in a lot of pain. So I just want to prepare you.
That was a therapist's office?
Yes! The receptionist, I have not yet asked her who the heck she's going to see, but I was like, you need to change wherever you're going, because I explained to her, I said, no, I went to OMPT in Plainwell, and no, it was not. If they notice, like I'm sure you do, with Hope, she could tell when it was, and so she'd back off and say, okay, we're gonna do some deep breathing for a little bit, let's stretch out your psoas, let's do something else. They'll figure out something else. So if the receptionist is telling you, I'm just gonna say this to all my mamas, and I'm gonna see this mama next week, so I will be having a conversation with her a little bit more in depth. If they tell you on the phone to embrace for a lot of pain, don't go. Find somewhere else, because it's not, is it gonna be maybe a little bit uncomfortable? Yes, but your PT does not want to inflict more pain. That's not the purpose. They're trying to help you be more comfortable and learn more about your body and how to breathe through things. And so
Yes.
Yeah.
I just wanted to say that,
Thank
like,
you.
right off, because
Yeah.
yeah, it's not supposed to be.
No.
So
yes, in a nutshell, see a physical therapist.
And
I really wish that it was part of that 6-week checkup,
I do
or
too.
even before, because in the world that I am in, working alongside a medical doctor, we have so many reps that come in, and sometimes, I don't know if you ever remember the show, any of you remember the show Ally McBeal? I have Ally McBeal moments all the time. Things are going in my head, a little baby's dancing, I'm like, what are you saying? Dude, you're confusing. There's so many medications for incontinence. There's so many pain meds, and doctors just go, oh, you're peeing your pants, here's some medication. Oh, you're in pain because your sex is what, here's medication. When really, if we just got to the root of it and took the time to write on a script, to send someone to PT, if you really wanted to stop it and not have to worry about side effects of medications, and really a lot of those medications, if I'll be honest with you, don't work very well. Just from experience, from hearing from different patients, they're like, this isn't working. And then of course, the reps, I will never say names, or be like, yeah, it has this kind of success rate. And then why are we doing this? Why are we doing this to people? Like, why are we spending so much time and money, and if they could just see someone like Hayley.
And in Michigan, you don't have to have a script to come see me, actually. Now,
Good to know.
yes,
That is good to know.
I want the doctor on board. I would send
Yes.
them back to their doctor after so many
See,
visits.
because that's what I do. See, when I advise something for a mama, I say, okay, well, you need to go back to your OBGYN and then talk to them, let them know that
Which,
you're,
again, it's
advise you to see a pelvic floor
It is
therapist.
good to have them on board, and that's a good way to go about it. But like you said, sometimes it takes 3 months to get into
Yeah.
CLB just for them to then refer you, when you really could actually call up our office and you could come and see me.
That's good.
In the meantime, and still have that appointment scheduled. So
Put it on your
yep,
to-do
there's-
list. If you're pregnant and about ready to have a baby, go see them beforehand and then see maybe a little after or whatever.
Yeah.
That's really good though, because see, where I went to
Direct
school,
access.
they pumped it in my brain so much that, right, you teach clients, I don't diagnose, see your OBGYN, see your DO, see your MD. They put it in my head, like that's what I'm supposed to do. So every time I'm like, don't know, I'm like, go see your doctor.
Yep.
I can't diagnose, go see your doctor. Like even when, cause I can check for like things like diastasis recti or that, but I always tell them I can't diagnose this, but I know it.
you have
I
all
know
the
that it is,
signs.
you
Yes.
know, but I can't legally diagnose you because I'm not a doctor. But anyways, okay.
So treat it.
So yes, I can treat it. Okay. How we did answer this one a little bit, but let's go a little bit deeper. How does our pelvic floor muscles change with the change or aging?
Yes, so like I would say every other muscle in the body, because the pelvic floor is muscles.
Yep.
Just like,
Yep.
bicep, anywhere else, you're gonna have breakdown. Just this naturally happens when we do hit menopause, and through that change, your body composition starts to change, and so you do have less muscle mass. It kind of does decrease a little over time. So that happens in the pelvic floor too. We talked a little bit about dryness that can be associated with this change, which is more of a hormonal thing.
Yep.
So you can work with a pelvic floor PT, because usually what's associated with losing muscle tone, losing muscle tone would be kind of weakness, right? Which then you could have some leakage problems. Any of these said pelvic floor issues we talked about earlier. Dryness might allude to maybe some painful sex as well. So that can also come around to then PT and get the education on what to do there.
Yes.
Yeah.
Perfect. When it comes for, I think you kind of touched base on this too, and it's just a question that popped up because I feel like sometimes I can hear our audience ask the questions as you're watching this.
Yeah.
When it comes to painful sex and if they need some type of lubricant, do you have one that you recommend most to your women?
I typically in my office I use one. It's called the Slippery Stuff. It's
Okay,
actually
Slippery Stuff. Oh, I
yeah,
have
it's
heard of it.
easy to remember. It's a water-based, but
Mhm.
Good Clean Love, which we talked about
Yes,
earlier,
this is the one that
is a good one too.
But like her and I were discussing, our bodies are all so different that my body likes the aloe based, and then the slippery, that one's water based.
It's a water-based. Yeah.
So yeah,
So you may need to try maybe a
Yeah.
couple, but
see what works.
I always tell people to stay away from KY or anything that's
Yes.
gonna have
Yes.
additives or make you feel
Your esthetician will
tingly.
say the same thing.
Yeah.
Those were in Revive and
No
Thrive
tingly
Network.
stuff. Yeah.
No.
Yeah.
Yes.
No.
And this is one thing I always say
Or fragrance.
because
Yes.
where I work, I am a medical esthetician. I work with Dr. Ronan, and our office focuses on female health. And a lot of my clients will, ask me different questions about skin, and then they go, "Oh, also I know you guys do this, but really should I?" And I'm like, "Okay, if you're putting hyaluronic acid here, you're hydrating. It means you might need to hydrate also." You know what I mean?
Yeah.
Everything is aging. Everything is changing. It's that big A word we all hate. But take care of it all. I think a lot of times we focus so much on this. I'm sorry, you could look like Kim Kardashian, but if you're peeing and pooping your pants, I'm sorry, that's just not very attractive. Let's not do that. Let's take care of that too.
Yes. All
Just
the
saying
parts.
it like it should be said. So kind of going into that, this person asked, I have loose gas and it's embarrassing. Can pelvic floor PT help? We answered that.
Yep.
Yes.
Yep.
Yes.
Yes.
That is a form of fecal incontinence,
Yes.
actually not being able
Yes.
to hold that. So, yes, pelvic floor
Yes.
can help with that.
Yes.
you want more specifics? Or?
You can do more specifics. I love learning.
I would likely I'd similarly treat like fecal incontinence, or at least gas passing, kind of like stress incontinence a little bit.
Okay.
And honestly, you could have both going on at the same time, but it really is a little bit more of strengthen and then kind of control. So coordination, how do things work together? But also I think when it comes to anything fecal is also what are like your eating habits like? Do you get enough fiber, enough water? Those things are also important to address.
Actually, I have another question I just thought of. Because my OBGYN put me on another diet. I feel like every single doctor has put me on diets. Now I'm seeing a nutritionist, now I'm like all over the place. And she put me on another new diet. She said for my tumors in my uterus, I cannot have tomatoes. Is that true? Because I'm like, tomatoes, it's a tomato. Like, I have like a list of like things that I can sometimes have blueberries. Sometimes you can have avocados are on the okay list, but not too much. And I'm like, you're getting rid of my whole diet of what I eat. Like
the acidity?
Yeah, so the acidity is not, it's too much for the uterus.
But it's because of for the tumors, or it's more for just like urgency feeling?
Well, she put me on it for my tumors. At least that's what she told me.
I don't know if that like
because I was like,
makes
how
them
does
grow more?
that? I know. I
works.
was like, how does
But
that? I don't know.
acidic stuff, acidic foods, citrus,
Can make it more irritated.
it makes your bladder, usually your urine, and even like your bowels. Yeah, it just makes things a little more irritable. So you may be more likely to leak or just things escape because they don't want to be in that environment. But I don't know.
Food is important. What you eat.
Yes.
80%. Okay.
Yeah.
Do you have any more questions? Okay. No. Okay.
I don't think, unless you can think of anything else.
Thank you so much.
So we really
Dr. Hayley,
appreciate
for
Haley.
answering.
So I just want to say, once again, see a PT if you can. They're great. Also, Rebekah and her Hope Inspired Fitness, definitely check her out for sure. I am with Aesthetics Medical. We do Empower. So if you need something a little extra, we have all those tools too. We work with Dr. A.J. Ronan in our office. So he also works a lot besides a physical therapist in the Lansing area. But you can also check Haley out virtually as well. That we just learned that, so I think that's awesome.
Haley, can you really quickly tell us again where Fuel is located?
Yes. So, well, right now we're in Granville,
Yes.
which I'm not currently seeing patients, but I probably could see
Okay.
if that worked better. But Granville, Michigan, and then downtown Grand Rapids, right off the highway down there. So.
And a CrossFit gym, which
Yes.
is super dope.
Yes.
I mean, cool. Whatever the word is.
We're actually in the gym.
That's so cool.
Which is even cooler.
I'm gonna have to go check that one out
Yeah.
because
Yeah.
Rachel and I love.
We rent
CrossFit.
we rent space from the gym, and then
That's so cool.
So we have our own private space, and then we use the gym with clients, and then we work out there. So it's
All right, awesome.
Yeah, we really love it. If you, I guess, wanted to get a hold of me, you could either call at 616-757-0932. That's our office number. But then also I'm wondering if, I don't know if you want to post like my email.
Yes,
maybe?
I will go ahead and post all of her information. It will be in this
social media.
link. Yep.
Okay, perfect. Yep. We'll do that.
Email and also. And then Rachel and I, where'd my file go? Rachel and I will be having do you have the EMF? Rachel and I are, can I see that? We're going to be doing a video in July. So July, we're going to be talking with Dr. Ronan about Empower. I got this done to help we'll go into all that when we do the video. What it did for me down below. All right, anyway, so we're going to go ahead and talk about this in July. So stay tuned and we will post when this video will be posted. Thank you guys so much. Thank you, mamas, for all your questions. We had some great questions. Thank you, Dr. Hayley, again for letting us use your facility and be here. All right, thank you very much and have a blessed day.
Take care.